How voters in the mood of the nation have responded to questions about the government's handling of the COVID situation. I want to welcome Dr. Naresh Trehan, Chairman and Managing Director, Medanta, the Medicity, and we've got Dr. Shashank Joshi. He's a member of the COVID Task Force in Maharashtra. Let's take you through question number one. How do people assess the centre's handling of COVID? Remember, perception about the government's handling of COVID had crashed in August 2021. In comparison, in January 2022, there's been a sharp about 17% upswing from 49 to 66%. The number of respondents who think the government has done a good job in handling COVID. The number of people who think the government's handling has been average is at 16%, which again is a big drop from 30%. So those who largely were in the average category now seem to have moved to the good category, because the number who thought the government's handling has been poor has come down only marginally from 19 to 16%. That's a data set that will give great relief to the government, where about 2/3 of the respondents think the government has handled the biggest challenge of the day well. Question number two, how do you respond about the state's handling of COVID? Your particular state, how do you think the states have done? 62% saying good. This was 55% in August, 17% saying average, and 18% saying poor. Dr. Trehan, the fact that the government's perception about the handling of the COVID situation has improved from 49 to 66%, is that just good marketing, or is this something which people feel they can see what's happening around them and therefore they feel the central government has done a good job in handling the COVID situation?
So Rahul, actually it's true that the central government has paid huge attention to the problem that occurred in August last year, as you mentioned. And what came out very clearly was that nobody expected that wave to be so high and so ferocious that it knocked the whole medical system, oxygen supplies, everything off the feet. So the point now is that after having gone through all that, there has been a lot of preparation at the center and the state, and also early sensing. All those mechanisms have been put in place. And there is a lot of preparedness on the ground, coupled with the fact that the vaccination drive has been very successful. So I think all these things put together, and the comfort that people are feeling today is from also again for two reasons. One, the preparedness for medical emergency or handling of COVID is already in place, but also the new wave, the Omicron wave, is not that severe. It is numerically large, still not reached the numbers of the last wave, but at the same time, it's very mild. So we are seeing it in our hospitals. At this time, if you were to deal with the Delta wave, at this time, our hospitals would be flooded. Today, even Medanta, which is the leading center for all these things, has actually got 120 patients, and only about 8 of them are on a ventilator. So there is a difference from what happened last year to now. But it is true that the preparation by the government for this one has been quite sort of well done.